Chapter 1. A Question of Survival. What happens when the system that's supposed to protect you becomes the very thing that puts your life at risk? In Jamaica, this isn't a rare nightmare. It's an everyday reality. A loved one falls sick, you rush them to the hospital, and then the waiting begins. Hours stretch into days. Medicine is out of stock, machines don't work, doctors and nurses are overwhelmed. And in that moment, a terrifying question hangs in the air. Will they survive the illness? Or will they become another victim of a system that was never ready to save them? Yes, Kingston Public Hospital stands tall as the largest in the Caribbean. Yes, Victoria Jubilee delivers thousands of babies each year. But behind those numbers lies a harsher truth: endless waiting, broken promises, and families traveling miles with nothing but hope, keeping their child alive until they reach the doors. Billions of dollars are announced for renovations, new hospitals, and modern machines. But the question is, are these lifelines for the people, or just words that sound good in a speech? Chapter 2. The Price of Survival. Every year, promises are made, and every year Jamaicans walk into the same overcrowded wards, sit on the same broken benches, and pray beneath the same leaking roofs. In 2023 alone, more than 14 billion Jamaican dollars was allocated to healthcare development. On paper, it sounded like progress: new operating theaters at Kingston Public, upgrades for Spanish Town, new scanners and ventilators. These are not luxuries. They are the difference between life and death. But deadlines are missed. Projects drag on. Cornwall Regional Hospital's renovation, first announced years ago, has swallowed billions and still isn't fully operational. Contracts go to friends. Equipment sits unused because staff were never trained, and as politicians cut ribbons on half-finished buildings, ordinary Jamaicans are left waiting, sometimes until it's too late. Chapter 3. The human cost. Doctors and nurses in Jamaica are among the most dedicated in the region. But dedication has its limits. Some nights, 2 nurses are left to monitor more than 60 patients. Surgeons cancel life-saving procedures because the theater isn't ready. For many, the only escape is to leave. Hundreds of doctors and nurses migrate each year, chasing better pay, safer conditions, and respect abroad. Every time one leaves, thousands of Jamaicans lose a piece of their future. Meanwhile, families struggle. Parents choose between paying for medication privately or watching their child suffer. Many borrow money at crushing interest rates just to afford a scan or blood test. For the wealthy, healthcare is a transaction. For the poor, it is a gamble. Chapter 4. Promises and Politics. Election after election, Jamaicans hear the same lines: modern hospitals, healthcare for all, a stronger system. But after the speeches fade, the reality remains unchanged. Cornwall Regional Hospital's endless delays and ballooning costs are just one example. Across the island, contracts are inflated, supplies are overpriced, and investigations into corruption stall or disappear. Every dollar wasted isn't just corruption, it's a life at risk, and the people pay for it twice: first, through their taxes, and again, when they are forced to turn to private care they cannot afford. Chapter 5. The private escape. Step into a private hospital and the contrast is staggering. Clean wards, working machines, no overcrowding. For those who can pay, it feels like salvation. But for most Jamaicans, private health care is a dream. An MRI scan can cost up to 60,000 Jamaican dollars. Surgeries climb into the hundreds of thousands. Families sell belongings, borrow from relatives overseas, or take out loans just to afford treatment. And when even that isn't enough, the wealthy look overseas. The poor stay behind, trapped in a system that fails them again and again. Chapter 6. Migration of Hope. Doctors migrate. Patients migrate. The cycle deepens. Jamaica trains some of the brightest medical minds in the Caribbean, only to lose them to Canada, the US, and the UK. Every departure is more than a statistic. It's fewer hands in the emergency room. It's another family who will sit in an overcrowded ward, waiting longer, hoping harder. The result? A system that bleeds talent, bleeds resources, and bleeds trust. Chapter 7. A future worth fighting. For can Jamaica's healthcare system recover? That is the question that determines the lives of thousands each year. It will take more than machines and buildings. It will take accountability, transparency, and respect for the professionals who keep the system alive. Because behind every statistic is a mother waiting for her child's surgery. Behind every scandal is a family deciding whether they can afford to save their loved one. And yet, there are signs of hope. Communities fundraising for local clinics, partnerships bringing in new technology, telemedicine connecting rural patients to specialists in Kingston and abroad. The path to recovery is not impossible. But it requires courage. It requires demand. It requires Jamaicans refusing to settle for promises and demanding results. Because the future doesn't just arrive, it's built. And if you want to keep uncovering the stories that matter most, don't forget to subscribe.